What happens when the system built to heal us begins to fail us? Aging isn't just about growing older. It's about whether healthcare is ready to protect the people who need it most. Every corridor echoes with questions we're only beginning to ask. Behind every waiting room door sits someone who has lived a lifetime of stories, now waiting for care that feels increasingly out of reach. Every day, millions of seniors face long waits, rushed appointments, and rising costs. The truth? The healthcare system wasn't designed for the wave of aging that's here right now. Hospitals and clinics fill with people who built our communities, who raised families, who worked lifetimes. Yet, too often, their needs go unmet, their voices unheard in the shuffle of an overburdened system. In crowded waiting rooms, they sit for hours, hoping for relief, sometimes leaving with little more than a new prescription and more questions than answers. Behind these walls, a silent crisis unfolds. The numbers tell a stark story. The population over 65 is growing faster than ever before. But resources, staff, and support lag behind. Why? Because the system still struggles to adapt to this unprecedented wave of aging. The result is more than inconvenience. It's a challenge to dignity, safety, and quality of life. Consider the hidden challenges that shape every day for seniors. Medication overload is a reality. Most seniors take 5 or more prescriptions daily, each with its risks, side effects, and interactions. Managing these medications is complex, confusing, and sometimes dangerous. Doctor shortages compound the problem. Fewer specialists choose careers in geriatrics, leaving fewer experts to address the unique needs of older bodies and minds. This means appointments are shorter, advice is rushed, and critical details can slip through the cracks. High costs add another layer of stress. Even basic treatments, routine blood work, physical therapy, regular checkups, can drain savings, especially for those on fixed incomes. For many, choosing between medication and groceries is an all-too common dilemma. Behind every bill is a decision about what to sacrifice, a calculation of risk no one should have to make. The emotional toll is just as profound. Loneliness and stress don't just darken moods, they worsen every condition. Seniors living alone or without regular visits from family face higher rates of depression, anxiety, and even physical decline. The cycle is cruel. Poor mental health leads to poorer physical health, and vice versa. In the shuffle of appointments and paperwork, these deeper needs are often overlooked. But what do seniors really need from their health care? Aging in healthcare shouldn't just mean more pills and hospital visits. It should mean dignity, prevention, and connection. Values too often lost in the race to manage symptoms. Regular preventive checkups, not just emergency visits, can catch problems early and keep people well, not just treat them when they're sick. Healthcare that is proactive, not reactive, is the foundation of aging well. Personalized care plans, not one-size-fits-all treatments, are essential. Every senior is unique, shaped by a lifetime of experiences, medical history, and goals. Care should reflect that individuality, listening to concerns and respecting wishes. The best medicine is tailored, thoughtful, and patient-centered. Support for mental health is just as critical as treating physical symptoms. Depression, anxiety, and memory loss can be as debilitating as any chronic disease. Seniors need access to counselors, support groups, and therapies that help them navigate the emotional complexities of aging. Healthcare must recognize that mental health is health. Families, too, must be included as partners, not bystanders. Loved ones are often the most consistent source of support, insight, and advocacy. Including families in decision-making and care planning empowers everyone. It means seniors are surrounded by people who care, who understand their needs and preferences, and who can help bridge the gap between home and clinic. Change is possible, and in many places, it's already happening. The future of care is arriving, quietly revolutionizing how we support aging. Virtual doctor visits bring specialists into homes, reducing travel and wait times, and making care more accessible for those with mobility challenges. Home-based care allows nurses and aides to provide support where seniors are most comfortable. catching problems early and offering personalized attention. Smart health devices, wearable monitors, medication reminders, and remote sensors catch problems before they escalate, alerting caregivers and doctors with real-time data. These innovations mean that aging doesn't have to mean suffering. Technology, when used thoughtfully, can restore independence and peace of mind. But innovation alone isn't enough. Real change means rethinking the entire approach to aging in healthcare. It means training more geriatric specialists, investing in community health programs, and designing policies that prioritize prevention, affordability, and access. It means listening to seniors, valuing their voices, and respecting their choices. It's about building a system that sees the whole person, not just the diagnosis. One that understands that health is more than numbers on a chart. Health is about relationships, purpose, and quality of life. It's about making sure that every senior, no matter their background or means, can age with dignity. Because aging in healthcare is about more than medicine. It's about humanity. It's about honoring the people who came before us, who shaped our world, and deserve to be cared for with respect and compassion. The story of aging is not just theirs, it is ours too. One day, each of us will face these same questions, will sit in those same waiting rooms, will hope for a system that recognizes our worth. The choices we make today, how we design healthcare, how we support our elders, how we value prevention and connection, shape the future for all of us. Let's build a system that heals, that uplifts, that treats aging not as a burden, but as a chapter worthy of care and attention. Because one day, this story won't be about them, it will be about us. And the future we create will determine not only how we age, but how we live.